So what is HRT? HRT actually stands for hormone replacement therapy. And when we are going through this menopause transition, it's our hormones which are fluctuating and depleting. Estrogen, progesterone and testosterone. So HRT is replacing or giving you back those hormones and trying to maintain a more balanced level throughout this menopause transition. Estrogen hormone is really important, and we have estrogen receptors all over our body. We have them in our joints, in our brain. It's responsible for the collagen, for the elasticity, our pelvic floor, for the lining of the vagina. And that's why we get these symptoms of hot flushes. That's why we get these symptoms of low mood, depression, and also why we get vaginal dryness, painful sex. So estrogen is a really important hormone, and if you think back to when you did have your periods, most women tend to feel their best probably a week or so after their periods have ended, and that's because our estrogen levels are high, and usually we feel our worst just before our periods because our estrogen levels have come down. So estrogen is really responsible for helping us sleep better, for our joints feeling not stiff, not achy, for our skin feeling sort of young and sort of elastic. So it's a really important hormone from a whole well-being perspective. We need progesterone if you've got a womb. So the reason why we need the progesterone hormone is, one, it does have, for some women, a calming and an anti-anxiety element, but mainly it's because if we didn't have progesterone and you've got an intact womb, then the lining of the womb, the endometrium, would thicken, and it would put us at a higher risk of endometrial cancer. So progesterone helps us to sort of keep that endometrial lining to a minimum, and so is a protective hormone in that respect. Now you might also think, well, why did you mention testosterone? Isn't that a male hormone? Yes, it is, but we as women also have it, and it's responsible for our muscle mass, for libido and metabolism, in fact. So one of the things that happens is, from the age of 20 to 40, our testosterone level declines. And what you will notice, or a lot of women notice during their menopause, is that they feel maybe a little bit more fatty, losing muscle mass, they're tending to put weight on around the middle, and also their libido goes down. So testosterone is an important hormone. Not all women need it when we talk about hormone replacement therapy, so that's something you need to discuss individually with your doctor. And hormone replacement therapy comes in lots of different forms, in tablets. I personally prefer, if possible, to prescribe it as a gel or as a patch and give progesterone in the form of micronized progesterone, because it is what we would call body identical. It's what our body produces. So it's chemically the same as what our body produces and is very natural. So, you can take HRT tablets, patches and gels, and those are the main forms that you will come across.